The Aversion Project involved homosexual men and women in the South African Army. It took place between 1971 and 1989. The project was conducted by Colonel Aubrey Levin, who was also nicknamed Dr. Shock after this trial took place. He was the former chief therapist at Utrecht Military Hospital, which is where many of the treatments took place.
The purpose of this trial was to forcefully alter sexual preferences. There were a total of 900 people that were tested in this trial. The ages of these test subjects ranged from 16 to 24 and were mainly white males. The treatments that were used included chemical castration, electric shock, drugs, aversion shock therapy, hormone treatments, and sex change operations.
Upon arrival of Ward 22, the patients were stripped of their clothes and shoes and given brown pajamas. The Army said that they were only to prevent escapes. Every new patient was put on Valium and also subjected to narcoanalysis or a truth drug, which involved a slow injection of a barbiturate before questioning began.
Michael Smith was sent to Ward 22 at the young age of 18 after Dr. Levin forced him to admit he was a homosexual. He was told by Dr. Levin that he would be given therapy that would reorient him, so he agreed. The treatment consisted of strapping electrodes to his upper arm with wires running to a dial calibrated from 1 to 10. He was shown pictures of naked men and encouraged to fantasize, and then the doctor would ratchet up the power until the patient could no longer take the pain. He says that it mostly freaked him out and confused him, but it certainly did not do anything for his impulses of attraction to men.
From this trial, we realized that homosexuality is not a disease and gender reassignment does not cure homosexuality. As a result of this trial, many of the individuals committed suicide due to emotional stress.
The health workers were to be loyal and respect the terms from the Geneva Convention and Tokyo Declaration. The stage was set for human rights abuse of patients under the care of such doctors. Dr. Levin should be held particularly accountable because he worked in an environment where he had captive subjects and he abused them. He immigrated to Canada at about the time he was warned by the Truth and Reconciliation Commission in South Africa that he would be named an abuser of human rights. He still denies that he ever gave electric shock treatment or harmed any of the patients in any way.
We feel that the trial was unethical for many reasons. Dr. Levin lied to the patients to get their consent and then harmed them greatly, especially the patients that he had undergo a sex change, because it did not help their homosexuality but just further confused them. These patients all had mental and emotional stress once the trial was over, and many commit suicide as a result.